primary task is to look after our customers and to care for our customers and to listen to our customers. It's all about this holistic approach, and we're not one-dimensional beings.
No, of course not. We're like gardens and ecosystems.
Yeah.
The body's evolved over millions of years, and this is what I love about Chinese medicine, is that it understands, Taoism as well, that it understands the human connection to nature, and that we've come out of nature and we're part of nature, and we need to protect nature, and nature looks after us and we need to look after it. Hello and welcome to Own Your Health with me, Katie Brindle. And today in the green chair, we have wonderful special guest, Kevin Leivers.
Hi.
And Kevin launched the Naked Pharmacy in 2016, and we are delighted to say is one of our key sponsors for the next 3 months. Our second wonderful partner is Evolve Beauty. And now the reason I love Evolve Beauty is because their lovely founder Laura Rudo is very close to my heart, in as much as she really looked at something which actually needed to evolve, hence the pun on the name. But actually she needed we all needed to evolve. We needed to come out of chemical-based beauty products which were bad for our skins, bad for our bodies, bad for our environments, and come up with something which is cruelty-free, which is vegan, which is pregnancy-friendly, which is environmentally friendly, and has a commitment to zero waste production and carbon neutral practices. That is quite the remit. I certainly know from setting up the Hey You method, it is really, really difficult to walk the path of integrity. You are being pulled in every single which direction to kind of cut corners, and you have to kind of really be committed to the evolution of everything in order to actually walk that path. Now, Laura has done just that. So that's exactly what she's doing. And again, with very, very highly clinically tested products, which are really good for the skin and really good for the environment. She is also giving us a bargain. She's giving us 20% off at till point if you put in this time Brindle 20. There are T's and C's that applied, so do please have a look at the description for more details if you need more information. But if you pop over to evolvebeauty.co.uk, you can have a look for yourself and take advantage of the 20% discount. And the reason why is because we literally will not have anyone in our green chair or our sponsors, because I'm very picky. And I'm very excited to be talking to you today because you made the jump from the dark side to the light. And the clue is in the name, with the Naked Pharmacy. So without me prattling on too much, I want to, Kevin, first of all, ask you about your background and what brought you into launching the Naked Pharmacy in 2016, and now the excitement of being in my green chair. So
Yeah, and it's very comfortable, by the way. It's kind
it
of like,
is.
yeah,
Very much so. So where did it all begin?
Yeah, it began in 1982, so quite a while ago, over 40 years, and I was the first 16-year-old to be recruited into the research department of Boots Pharma.
Wow.
So in the days when 16, yeah. So I had quite a tough time at school, so I wanted to leave, but I also wanted to get something. I was really fascinated by science. You know, even as a sort of 12-year-old, I was really into my science, and I had this belief that I had it in me to discover something that could solve a major health problem, even at 12.
Wow.
And
a calling. So you've got a calling. I was
had
like
a calling at 12. And so I always had a fascination with nature, but that sort of the strong connection came much later on. And so I landed in this sort of very academic, steeped in history research department, and I was interviewed by the chemist that discovered ibuprofen, and I worked with all these amazing PhD chemists that were formulating new drugs, and I spent the 4 years there, and I just learnt so much. And but there was also questions coming out of that work. You know, I remember a conversation about inflammation with John Nicholson, who was the chemist I was talking about.
Yeah.
And I said, "What is inflammation?" And then he sort of drew this cascade of chemicals, biochemicals in the body. And he said, "Well, ibuprofen blocks here, and this stops all these inflammatory chemicals from sort of wreaking havoc in the body." And I thought, wow, that's really, really impressive. But why does inflammation occur in the first place?
Yes, the why. We are the kids in the back of the car going, but why, but why, but why?
Yeah.
And
Yeah.
and eventually the parent stops answering.
Yeah.
And they go, because I said so.
I mean, so rebelliousness is really useful and really important to
and the key to science as well.
Absolutely.
Not that I'm a scientist, I'm a Chinese doctor, but nonetheless, it's the same question.
Yeah. And so that questioning came all the way through. So I left after 4 years. I did a pharmacy degree at Bath University. And at first I was really motivated, but coming out of the university degree and then going into practice, suddenly I got demotivated and very, very deflated, because suddenly I was in a pharmacy and I kept seeing these patients, these customers coming back, and I could see the prescription rolling. So polypharmacy, we call it in the profession. So they start with one drug, and then suddenly, so they might start with an anti-inflammatory drug like ibuprofen, and that starts to affect the lining of the gut.
Yep.
And so they might have an ulceration of the gut because of that, or bleed. And so they start on an antacid to solve the problem caused by the first drug, and then it rolls and it rolls. So suddenly, the antacid is starting to affect the biome, as we call it now. We didn't know then. But obviously that's then starting to cause malabsorption. So perhaps their B vitamins are not being absorbed. I'm talking about it from my perspective now, but obviously at the time I didn't really understand it holistically.
But of course, from a pharmaceutical background at that moment in time, drug rolling probably is quite a good thing, because it means you can sell more medication.
Yeah.
Not you personally, but more medication can be sold.
It didn't sit well with me, because sometimes they were coming back and they literally have 4 pages of prescriptions, sometimes 4 or 5 items per script. And I thought, well, these people aren't getting any better. So after a year doing my sort of pre-reg, what we call pre-reg training, and a year in retail pharmacy, I kind of stopped and I took a break. And I end up traveling and exploring and thinking about things and thinking, well, where do I go next? Actually, I've done this degree and I think I don't know what to do with it. And I landed in Australia without any money and thinking, well, I need a job. And actually then I started looking around and I found this big pharmaceutical company based in Australia, and 700 people. It was making a lot of injections, and so I thought, well, I'll go and work for them and I'll see how it's made in from source really. And so ironically, I made a lot of painkillers like morphine and diamorphine, and in huge quantities. It fascinated me. I learned a lot in terms of quality control and all the manufacturing techniques. But again, it wasn't really the answer to me. And so after a while, I came back to the UK, and as luck would have it, the first job that came up that I saw advertised was the head of manufacturing for Weleda, which is a Swiss herbal company. Yes. Thought, okay, right, I've had some experience, so I'll go into this job. I'll do 2 years, and then I'll go back into big pharma, with my big scale, pharmaceutical manufacturing. But what shocked me and pleasantly surprised me was that there was so much I didn't know as a pharmacist. So in terms of natural chemistry, in terms of how useful kind of natural ingredients could be, whether it's botanics or minerals from natural sources, how impactful they could be in terms of people's health. And, Weleda was set up, I think it was something like 1920s. Yeah. And so it'd been around a long time, and that philosophy came from Steiner and Dr. Weigmann, who worked alongside him to develop this sort of sphere of medicine. And
it's a Swiss brand, not German.
It's a Swiss-German brand, right. Yeah. So, but it's now all over the world.
Yeah.
And so I ran the UK operation, but I did a lot of European stuff with it. And because it's a relatively small company, I don't know, 110 people, I got a huge range of tasks, responsibilities. So I learned a much wider range of disciplines. And as a pharmacist, that was like amazing to me that I just didn't know this stuff coming out of university. So that kind of opened me up massively, and I was there 11 years as chief pharmacist.
Wow! So what happened to the 2-year plan?
It went out the window.
Right,
so
because why, you were inspired?
Yeah, I was inspired, and also I realised actually going back into big pharma, actually I was going to get stuck and compartmentalised, and this thing about compartmentalisation kept hitting me, which is the approach, the old-fashioned pharmaceutical approach, was to zoom in on one particular biochemical process and block it or enhance it or manipulate it. Yeah. And actually, the body's not like that, is it? And actually, when you start blocking one process, there's sort of this imbalance that happens, which is like the gastric ulceration with anti-inflammatory drugs. And there's if you get we'll call it BNF, British National Formulary. If you look at the list of side effects for every single licensed drug, you'll be really shocked at the number of side effects related, serious and non-serious, as they call non-serious. But they impact on quality of life. So for me, I was starting to get this picture of this journey that we're taking, and what I saw was everybody has this story. You know, we talk about symptoms, but actually more important is the story. And there's something happens in your life journey where there's a trigger, something maybe traumatic, maybe health related. They might have, you know, I don't know, E. coli on a holiday, and suddenly that impacts the biome, and then it starts to snowball. And so there's always when we talk on the phone, so you know, we at the Naked Pharmacy we have a group of 9 pharmacists. It's unheard of to have that many pharmacists in a pharmacy these days. And we look into that story. So what was the point, if you look back, where before that point you were well, and after that point you suddenly snowballed and you got sick? And
people know. This is the thing. As a Chinese doctor, we do it's the same thing. We have we do the traditional diagnosis. So when a patient comes in, which is what we do now, and it's another reason, guys, why it's so brilliant to partner with you, because we're walking the same walk, which is we give all this information for free. You know, we really want you to get well, and we don't want to perpetuate the illness. But when people came in, I always found people knew what the problem was.
Yeah.
And it's a very empowering thing to learn that as having been a patient as well as a practitioner, that you know when you got sick, you know what caused the problem. But sometimes the body just needs this extra bit of expertise. It's like a garden whereby you go, oh, right, that bit of mossy damp over there, that needs 3 years of this, or it needs a bit of this, and then you need a bit of that. But we don't seem to have it with our healthcare system in the mainstream.
I think it's part of it is training. And I think it's part of the philosophy that we've grown up with. And if you think about pharmacy and medicine, it really started in natural medicine and herbs and botanics and minerals and stuff. That was medicine. And the first pharmacies in the 1800s were all herbal. I mean, obviously some of those remedies were not really based on science at the time. But
actually were really, really dangerous.
Really dangerous. So actually, I having worked with Boots the Chemist, which came from Nottingham, I come from Nottingham. Weirdly,
studied in Nottingham. I was in Florence Nightingale Hall.
Oh, I knew that.
I
knew that. Yeah, and great place. And for me, it was quite ironic that I've actually set up a pharmacy, just like Jessie Boot did. Actually, Jessie Boot set up a pharmacy for the right reasons. It was all about community. It was all about individuals' empowerment with health and education. And I wanted to recreate that and also rediscover these kind of hidden treasures that we've got in the natural world, and actually teach people that lifestyle interventions and holistic approaches to their health, whether it's nutrition, whether it's using supplements and herbs and minerals and movement and massage, it's all about this holistic approach. And we're not one-dimensional beings.
No, of course not. We're like gardens and ecosystems. The body's evolved over millions of years. And this is what I love about Chinese medicine, is that it understands, and Taoism as well, that it understands the human connection to nature, and that we've come out of nature and we're part of nature, and we need to protect nature, and nature looks after us and we need to look after it. And we've come into the health space. You came into it sooner than me. So you launched the Naked Pharmacy in 2016.
Yes.
Now, that's a very different landscape then to what we are now. And presumably you were leader for 10 years before that.
11 years at Willeda. I left in 2004. And then I set up a research and development company with about 6 other pharmacists. And we managed projects around the world. And we did huge amounts of research into beetroot, for instance, for blood pressure. Did some work with the William Harvey Research Institute. Things like broccoli substrates. These are biochemicals within broccoli after you digest them that are amazing for acne, for instance. And what I could see was it suddenly kind of blew my mind, because foods at a sort of normal level. So I don't know, maybe if you'll have like half a beetroot, for instance. That's a nutritional value, but actually if you concentrate them further, then they start to have medicinal effects without the side effects that you get with conventional drugs, because they've often got many biochemical ingredients. And so it's what I call this holistic orchestra effect, or the rainbow effect. So you've got a polypill in there, so lots of different biochemical actives in there, and you're concentrating them to a level that they're much more impactful and very suited to solving health problems. So, for example, we use bergamot fruit, and there's been probably over 200 clinical papers or human research that were the same style, same quality that we would have used in big pharma, and they prove that bergamot is as good as a statin. Simvastatin is an example, which is a very commonly prescribed statin for lowering cholesterol. But they don't have the muscle ache side effects you would have with statins. So the bergamot is a much higher strength. So literally 2 capsules is equivalent to about 8 bergamot fruits. So obviously you're not going to consume that many bergamot fruits every day for 3 or 4 months, because their clinical trials sort of span over a 3 or 4 month period. But if you do sort of formulate at that strength and you're taking them regularly, they will lower your cholesterol. And actually, why wouldn't you take a natural approach, or at least give people a choice? So that I think that's what it is, empowerment and choice. So we're offering people a choice. Actually, you can intervene here before you get down the road of big, heavy pharmaceutical drugs, which have an impact on other systems and can have side effects. I'm not necessarily against pharmaceutical interventions, because obviously if you go to a hospital and you've got appendicitis, you're going to need a muscle relaxant, you're going to need an anaesthetic, you're going to need a...
But that's acute.
But that's acute. But actually, let's prevent. Actually, I see some policy coming out of the government that says prevention rather than treatment.
Oh, hallelujah.
Yeah, finally.
Yeah, exactly. So, it's not like we haven't been banging that drum for about 20 years.
And actually, this philosophy, you talk about Chinese medicine, you talk about Ayurvedic medicine. During my time at Walida and beyond, I started fusing them together because actually you should have the best of all worlds. And when you look at the philosophies and approaches to medicine holistically, often there are a lot of similarities to TCM, traditional Chinese medicine, and Ayurvedics. And so the style and the approach and the breaking down into a much more holistic system, and actually the Walida approach, the anthroposophic approach, is also very similar. There's some elements of each which kind of tie into each other, and the way they view herbs and the way they interact with your body. So, and I find that really fascinating.
It is. Right, hang on. You've said about 100 things, which are all really interesting, and everything you said, I'm like, right, hang on, we need to expand this out a minute. So let's just recap for a second, because this was super interesting. The first thing that you're talking about is, or one of the first things, was that you're talking about super strength nutrition, by basically taking something like a humble portion of broccoli and effectively compressing it and condensing it and intensifying it into, say, a capsule format, which can then in turn have an incredible over and above beneficial effect on the body than just eating broccoli every day, e.g. Okay. So the first thing about that is people, obviously, the first thing people need to do is eat a healthy diet. Obviously. But then, so from a Chinese perspective, when we've got this thing called the 8 Immortal Healers. Okay, I love it. And I think the book's up there, actually. Oh, yes, it is, because it's one of my all-time favourite books. It's called The 8 Immortal Healers by the great Grandmaster Mantak Chia. And one of the 8 Immortal Healers is, of course, food, nutrition. But then after that, the next immortal healer afterwards is supplementation, which is really where we're sitting here, because what you're saying is you're going to take the nutritional benefits of food, but you're going to take the and you're going to intensify it to make it, well, you said the word cure.
Yeah.
Are you allowed to say that? Because you're a qualified, trained, degree-level pharmacologist, you're allowed to say, I'm not allowed to I'm never allowed to say that word. I have to sort of duck behind it all the time and say assist.
I prefer to use solve problems.
Right.
So obviously you have to be careful, but they do solve problems.
Right.
And they are effective, safe solutions that can be viewed alongside other solutions, and so people can make a choice about what they want to do and how they want to approach.
When they work with you, the thing that I love so much about your brand, apart from listening to you and how your whole everything about your life story infusing into this brilliant product, these products, is that people can phone your pharmacy. So it's not just roll up, buy a supplement and then don't come back. It's actually come and talk to us. And then what we can do is listen, which is the most important thing when you're trying to give advice, is to actually listen to what the problem is and recognise that the person at the end of the phone may well already be on Western medicine, is likely to be.
Absolutely.
You need to understand, which is what you were saying earlier about what caused the problem in the first place. You mentioned holiday E. coli, for example, because it may be that that's what's causing the problem, or it may be because they're on a Western medicine which may be aggravating the stomach lining, for example. But you've got a trained person at the end of the phone who's able to advise with authenticity and with qualifications.
Yeah.
So it's safe, which is another word you used, which I liked.
Yeah, it's really important to us, safety and efficacy, and the quality elements behind that, the process that we go to source the growing region, because that has a massive impact on the strength of these bioactives. example, arnica, for instance, at Waleeda. We tried to grow the arnica at the Waleeda Gardens, fantastic quality of soil, but it just wasn't at the level of altitude that arnica likes. And actually, if you tested the bioactive between that and Switzerland, there was no bioactive in the Derbyshire grown arnica.
Yeah,
so
because the conditions are wrong. It's like Jim saying it has to be like Siberian is the one because it's tough. For the plant to survive.
The plant loves that stress, and it creates the chemicals as part of that. And saffron, for instance, we get our saffron from northern Spain, and
not Galicia, I'm sure.
Probably
where it rains like
but it likes it. It flowers in the winter there, and harvested over a 2-week period, and it's still handpicked. So as you can imagine, but literally, it's probably about 100 times the daily dose is 100 times the strength you would have in your food if you were using it to flavour a dish, whatever. So the step change in terms of strength and the bioactive strength has to be tested every batch, because year to year you have batch to batch variation according to the climate.
Changing climate.
Yeah, absolutely. So it's those sort of very simple common sense disciplines that doesn't tend to happen within this arena very much.
People can have a relationship with a pharmacist.
Yes.
What is it, like a call centre? I mean, what is it?
So,
it's like a load of people in a room with a headset on.
We have a pharmacy.
Or are you all kind of like formulating? Go, hang on, we've got Mrs. Wiggins on the phone. Can you come and have a chat? I mean, how does it work?
Yeah, so we all get on the phones and we all get on the email system. So, and the pharmacists we have sort of all involved in the formulation process and the quality assurance process. So
they have a day job as well.
They have a day job, but the primary task is to look after our customers and to care for our customers and to listen to our customers. So most of it of the contacts through email and calls, but we do have quite a lot of content on questions coming through on social chat. So
it's just like
we look
us.
after those.
No one phones. We used to have a phone, but I actually lost it. And I don't know what. So now it's all email. But we say this at the end of each episode. Always email in, put your comments on the things below. Then you get me looking at it, and if I'm not sure, I've got 2 masters that I work with. So if it's flummoxed me, do you find that as well? So you're all in the lab formulating, then it's suddenly like, oh gosh, what do we do about this? And then you all get your heads together and you have this massive conversation about something really obscure.
I love those conversations because we get different perspectives on it, and for me, when I started, it was me and one other pharmacist, so it was kind of a little bit of a narrow conversation, and you feel like you're sort of spreading yourself too thinly. But now we've got a proper team, 9 pharmacists in total, 5 in-house and 4
That's a lot
reserves.
of pharmacists.
Yes, a lot of pharmacists, and we get thousands of calls and emails every month. It's just incredible.
Yeah, because it's complex stuff. And the thing is, if you actually want to work effectively, because one of the things that I find so annoying in this thing is the sort of oversimplification. Because on the one hand, as I always say in these episodes, that there are kind of 3 key things you need to know to owning your health, which is the circulation needs to flow smoothly, the body needs to purge and nourish, which means it's got to release what it doesn't want and bring in the good stuff, which is where you guys come in, and then you've got to strengthen the 5 key organs. And yes, that is a simplified actual ABC of health, which is those 3 things have to happen, and if they don't, you're going to start to notice it. But over and above that, it's a bit like a language. It's like sort of when you first learn French, you can do a little bit of basics to get you started. Then it gets really complicated, and then it gets really simple again. I always find that ultimately, yes, it does. The variation and the individual and the needs and the dosages and the formulations and the cocktail that you could offer and say, well, actually, you could take this, and this together because your particular situation lends itself. But then it gets simple again because it's ultimately, and then the body will balance and then it will feel better.
Yeah, I think it's amazing when you see that in practice.
And it does work.
It does really work. I mean, when we first started and, you put I'd left my very lucrative consultancy business and to start this because I really felt as if there was nothing there to provide a service to UK and beyond. It was kind of, and I saw that the number of pharmacies on the high street shrinking, so people's access to healthcare practitioners that really look at things holistically, it's really hard to kind of navigate that,
especially for free.
It is, especially for free. And I mean, for me, it was quite nerve-wracking putting a lot of money on the line. All my time, I'd left my job. We've got a young child, so it's kind of like the pressure of that is incredible.
God.
And
I bet you were taking Saffron.
well, that's part of the reason why I formulated it. I think just to take the stress of being an entrepreneur at an older age as well.
Yeah.
And actually, we had a couple of cases came in literally within a month of launching. Saffron was our first product, and launching the pharmacy, and then it just kind of reassured me, because I thought, wow, so that your instinct and the data, the science behind it rings true. It's flowing through to the end result, which is what I needed to see. I mean, there's no point in having strong data and a good instinct if you weren't actually seeing that back in terms of the responses. Otherwise, I would have given up, I think. And there was one guy who was agoraphobic, and he hadn't been out of the house for like 3 or 4 years. And literally, his practitioner phoned me up, and he said, I don't know what you've done, but this guy is cycling to his mother's house every day. Wow.
Brilliant.
Just amazing. It
makes you cry, honestly, when you find. I know, you think, oh my God, this is so fantastic.
Yeah, and a year later, he was in a job and he got married, and his life kind of pulled back together again.
Yeah.
And there was another one who was a bit closer to home. Actually, we got introduced to him via an acupuncturist that we know and respect, and he was an incredible guy. I mean, he doesn't mind me sort of explain this story because it is really inspiring. He was a creative guy. He worked on all the Harry Potter sets and stuff.
Wow.
So creating the sets, he made the wands for Harry Potter, and he had been to the dentist, and he got a gum infection that had gone through to his heart, which is what can happen.
Yeah.
So have a tooth extraction. So a simple kind of thing.
Yeah.
But for some reason, and he got endocarditis, which is where the heart valve gets infected, and so he was spiraling. He couldn't walk more than 100 feet without getting out of breath.
Oh my God.
He was exhausted. He was in a lot of pain. He was taking a lot of painkillers.
Yeah, and then you can't work.
Couldn't work, and that's having an impact on many different things. And he was depressed because he hadn't, he'd been like that for 2 years. He'd been going round and round in circles. And he phoned me up, and I said, look, this is completely, off the scale in terms of, story, but let's start with the pain. So let's start with really high dose turmeric and black pepper, and see if we can come down. He was taking like 10 painkillers a day, different types.
Yeah, and there's a lifespan on the amount of painkillers you can take.
Yeah,
because of course you become tolerant to them, and
absolutely.
then it gets really
and the
bad
impact
for the
on his
liver.
biome probably was huge. And so, and then I gave him some black garlic for the infection, not knowing whether black garlic would work, but I knew that it was very good for infections, bacterial infections in particular. And I gave him the Saffron because obviously he was depressed and he wasn't sleeping. And literally, within about 6 weeks, he phoned me up and said, "Oh, I'm off all my painkillers."
Wow!
So completely pain-free with the turmeric. Then his depression lifted. Took a bit longer, about 2 months for it to really come away, and consistently. And then it was about 2 or 3 months later, he said, I'm walking and now I'm jogging. So then he was back to work, got married, and
my God, you're like the matchmaker. Everyone gets married. So careful if you don't want to get married.
And had kids as well. So we got this letter from his wife that we were in tears about.
Of course.
So thank you for giving my husband back. It was just that profound. I mean, these are extreme cases, but we see it in little microcosms with different customers and different conditions and stuff.
All with the Naked Pharmacy, because you sort of talking about the old apothecary type pharmacies that were across Europe, sort of coming up in the 18th, 19th centuries, but they would be using tinctures, pomades, powders. Do you use all of the different things, or is everything based on supplements in terms of capsules?
At the moment, it's based on capsules, and a lot of it is kind of resource, and we're building. Obviously, the pharmacy is growing. We've got now a proper pharmacy team, which is great. So actually, we're starting to spread our wings and look at some of the more traditional remedies that have perhaps got lost in the history of time.
God, now this is where I start getting really, really overexcited.
So I love my pharmacopoeias, and so there are lots of things in there that just disappeared. I mean, pharmacies. When I first started in retail pharmacy, you actually made these up in the back of the pharmacy, and then they disappeared into these specials units, and now
They
most
don't do them.
GPs won't prescribe them, even though they're in the textbooks, pharmacopoeia, Martindale, and stuff like that. That we're brought up with, we're trained with. And some of them are just incredible, but they're just lost.
Yeah, whereas in Chinese medicine, of course, I mean, I remember when I very first went, the first experience I had of China mainland, I went to Hong Kong. This was many years ago. And I hadn't been to China at this point. And I literally got off the plane and walked into the airport, and there was a pharmacist, and I just burst into tears. I mean, it wasn't like I understood Chinese, or actually it was Cantonese, but just seeing the packaging and all of the different sort of pots and tinctures and just everything. And I was literally just standing there, and I started shaking, and I was literally crying. And I was with my friend at the time. She's like, what's wrong with you? You're really weird. What are you doing? You're making a spectacle of yourself. I was like, it's so authentic, because this is how medicine should be offered. Never mind the prescription process. It's just the format within which you take these things. Pills and tablets is just one way of ingesting things through the body. You can use the skin, you can use washes, you can use baths, you can use foot baths, you can use salts, you can use all these different ways. And of course, they didn't have the witch hunt. I mean, they didn't. And, they did quite a good job of destroying quite a lot of their medicine last century, but it was only a century ago, so we can kind of rally it all back. But it's so exciting to listen to you saying this, going, actually, I want to resurrect all this fantastic stuff, because it's pre-witch hunt stuff, isn't it? She says, not wishing to sound conspiracy theorist.
Yeah, and actually combine it with science. So
yes, absolutely.
If you look on our website, there's a research section, and you can always ring us up or email us and say, send us the data on this, so we can explain it, can break it down for people that perhaps need a bit of support there. But it's really important to us that we have that, so that we can argue the case. So it's good that we get challenged, and we do get challenged, and actually we come back to them and say, well, actually, here's the data, have a look at it, and if you want to have a conversation about it, sometimes on social media you might get one or two kind of like jumping up and down and saying, well, this doesn't work, how can you say that? Well, actually, here's the clinical paper, and if you would like to kind of have a debate about that, then I'll call you. And then it's incredible how quiet they go when you say that.
Yes, because they're hiding behind a keyboard.
Yeah, exactly. Yeah.
So one of the other questions, I guess, is in terms of the fact that at the moment it's capsule based. What's your opinion about the fact that some people say that the stomach sort of breaks things down and kills things off before it's got a chance to get into the digestive system? Have you taken that into account, presumably?
Yeah, we formulate. We never use any synthetics in our product. And
that's another key thing.
It's a really key thing, because actually probably 99% of the supplement market in terms of vitamins and minerals are synthetic sourced. And the reason I say that is not because I have a thing against them per se, but if you look at the process by which they're manufactured, they often use quite strong solvents.
Right.
So not water, not ethanol, which can be evaporated off. So things like toluene and xylene, these are petrochemicals. And there is a limit in Europe, in the European Union, where you're allowed to have a certain percentage of solvent residue. So most people don't realise that they might have something like 0.5, 1% of these solvents coming from maybe 2 or 3 stages back in their finished product.
All
and
ending
that's
up in your liver.
permitted. So they're taking these, I don't know, B vitamins or lots of different forms of magnesium, for instance, and they don't realise vitamin C, classic case, ascorbic acid. Most of it's coming from corn, and some of which is GM corn, 6-stage process involving solvents in that process. So they think they're taking vitamin C, but it's not vitamin C, it's ascorbic acid made synthetically in a 6-stage process. So there's a lot of there are a lot of skeletons in the closet with supplement industry that people need to be educated on.
Absolutely, but you've done that work for them.
So we do that work for them, and that's why we extract our vitamin C from amla.
Right.
So the reason why you were asking about the different forms, absolutely, I have nothing. I think that it's great to have liquid tinctures. We used to use them all the time at Walida.
Creams and poultices.
In terms of the powders that we use in a tapioca capsule, we add a fibrous prebiotic to everything that we formulate. So that acts as a nice little protective layer around the actives themselves, but also lines the stomach as it's going through. And with a probiotic, we use slippery elm, and slippery elm's a fantastic liner for the stomach, because obviously and the digestive system per se, but it's also quite protective for the probiotic bacteria as well, so it kind of forms a little film around them. So it's just a natural way to to allow it to go through the digestive tract and to be absorbed. And that,
Yes, because not everything's absorbed through the stomach. Often things are absorbed through the small intestine or the whole digestive process. There's all sorts of different things being absorbed at different times.
And you want to, actually, people say that acid is a terrible thing, but actually we've made acid the enemy. But acid is really important in the stomach.
Of course.
It's the preparation of your food. And actually one of the problems with antacids per se is affecting the pH to a point which your food's not necessarily being prepared in the right way. Also, you're much more susceptible to infections. So E. coli, for instance, if you're on a PPI, proton pump inhibitor, you're much more susceptible to those type of infections because your acid is not as strong as it should be. So there's lots of impacts of if you're making those sort of changes to your stomach acid that have knock-on effects to your digestive system, which are not necessarily good for you.
And again, this is why I love to be partnering with people like you, because the thing is, it's so confusing and there's so much misinformation out there that it's so lovely to work with brands which have done all that thinking for you. And then they go, right, all you have to do is email us in, give us a quick kind of lowdown on what's going on, like what your problem is, and if you're on any medication, so that we can give you really good thought through advice. And then all these other issues and all the sort of conspiracy theories or the fear mongering is, oh, well, it doesn't work anyway, you're just making expensive urine and all this stuff's nonsense, blah, blah, that you can kind of, you've done all that legwork so that actually what you're offering is a really good product that's actually going to make a difference and actually serve the patient and the customer in the best possible way.
Yeah, I just couldn't or wouldn't do this if I wasn't having an impact. And you know, we review everything that we formulate in terms of both the data that's the clinical research data, but also the impact on the customers. So you know, if we're getting feedback from that, and you know, when we first started with Saffron, people were taking it in the evening, but we realised actually it's better, more effective in the morning, and that was just kind of from feedback that we were getting. Why it's more effective in the morning. My theory is that the cortisol level is higher in the morning, and therefore it must be affecting that. But it is a theory. But that's the practice kind of change the way we're doing things in terms of feedback that we're getting from the customers. That's really important. But no, I wouldn't do this without proper seeing the results in the field.
So one last question then is, you have many products and you've been in the market now since 2016. So if somebody wants to start their journey with the Naked Pharmacy, is the best thing for them to message in and basically give you a bit of a lowdown on them? Or is there a couple of supplements that you would say everybody needs to take this in this day and age?
My favourite is Saffron because it was the first one, and it's a really quick 5-day impact. You can see change in the first week. So it is key, because
sometimes it's 3 months and that's a bit like,
I've got to wait that long. And I always say, you know, monitor your improvements. So draw a line on a piece of paper every morning or every day, 0 to 10, and mark if it's sleep, you know, 10 is being the worst sleep ever, and 0 is that I'm actually, you know, I'm sleeping like a baby, and just mark and track the improvements. And it's a bit of a simplistic way of doing it, but at least you're actually doing something quantitative.
Yes.
And assessing your improvement, because if it's not working after a month, then actually you should change. Your approach should change. And I'm not a person that says you just need to stay on these for life. I want you to get better, and actually your body flicks back into a healthy state, and you only retake it if it kind of starts to slide back into its previous kind of unhealthy state. So Saffron, great sleep, nervousness, low mood. So it's a common, you know, these 3 areas are common symptoms. So particularly this time of year, coming into autumn, winter. So I think Saffron is one of those easy ins, and we've got a different version. So if you're feeling a bit sluggish, then there's Saffron Energy. If you're agitated and you're feeling nervous and you're not sleeping, then Saffron Calm is the way to go. So those 2 are my favourite. Magnesium, I know it's kind of a bit of a buzzword at the moment, but again, quick impact, relatively low cost. And our magnesium comes from seawater. It doesn't come from a chemical. And the seawater has all these micronutrients with it, as well as the magnesium. So it's kind of like, again, it's this orchestra rainbow effect that's having effect on different systems within your nervous system and rebalancing it and very quickly. So literally you can take a magnesium before your bed if you've got restless legs, again, it's quite a common
brilliant for
symptom,
that,
and
yeah.
just settles it really quickly. And there's 50% of the population probably deficient in magnesium. It's a really common issue. After that, if it's something a bit more complex, then absolutely call us, and you could even book an appointment where we call you back. And we know people live busy lives, so choose a time slot, and we'll call you back. So you've got dedicated time. Absolutely. And there's a big team. There's a lot of experience, over 100 years combined experience.
I mean, it's just brilliant.
Yeah.
Honestly, I mean, Kevin, it's been so incredible to listen to just your story, and what a brilliant brand, and just thank you for putting your life on the line and to have the courage of your convictions, because I know I did the same thing myself, and often it's hard. You've got no investors and no one's listening, and everyone thinks you're mad, and everyone tells you it won't catch on, and you've got this opportunity to go and work over here and get your pensions and all the rest of it, and they're trying to drag you over, and you went, no, I'm going to do it. And just to say to anyone listening that you've very kindly given us a discount, which is KT20. Is that right? Is it KT20? Yes. So KT20, if you go over to thenaturalpharmacy.com.
Thenakedpharmacy.com.
Sorry, the Naked Pharmacy. Sorry, it's getting the end of the day.
Yeah.
Thenakedpharmacy.com, and you put in KT20, you'll get a 20% discount off these brilliant products. And of course, before you even do that, if you want to have a consultation with one of your 9 pharmacists, it sounds like they all have a consultation between the 9 of them afterwards. You're getting a lot of expertise. Then do please message in, and
Absolutely.
they'll be able to help you. So, Kevin, thank you so much for coming in and creating your brilliant brand. And I'm honoured to be partnering with you, and I look forward to speaking to you again.
Yeah, me too. Thank you very much for inviting me.
Thank you.